sleep propped up or on your side, consider speaking to your dentist about a mouthpiece device. Be sure to address any nasal congestion, and take a decongestant or antihistamine if that is the cause. Consider using nasal strips or a sinus, nasal rinse. Lastly, speak with your doctor if you struggle with chronic sinus infections. Diagnose your particular snore. Do you snore with your mouth open or closed? Learning to distinguish between kinds of snoring will help you to address the particular causes of that kind of snoring. Avoid things that make snoring worse. Alcohol, sleeping pills, coffee, and fatty foods before bedtime can all increase snoring by making your throat muscles relax and narrowing your airway. Large meals and fatty foods likewise restricts your airflow by pushing up on your diaphragm. Keep your bedroom more humid. Dryness is often a cause of snoring, so using a humidifier or taking a hot bath or shower before bed can help alleviate snoring by keeping the breathing channels moist. Take up the didgeridoo or practice singing. While it may sound strange, singing or instrumental practice that strengthens the throat muscles will firm the tissue of your throat and mouth. Doing some simple mouth and throat exercises like singing will strengthen your throat so that it does not relax and block air when you sleep. The throat muscles involving in playing the didgeridoo are perfect for preventing snoring. Prop yourself up for sleeping. If you sleep on your back, buy yourself a few extra pillows and prop yourself up in bed, rather than lying flat on your back. Also, raise the head of your bed. An easy way to do this is to place several flat boards under the legs at the top end of the bed. A couple of old phone books under each leg should also raise the bed enough to do the trick. Try sleeping on your side. There's a good reason you don't want to sleep on your back. In that position, your tongue and soft palate rest against the back of your throat, blocking the airway. Try mouthpiece devices, also known as dental appliances or mandibular advancement splints. These are usually small plastic devices worn in the mouth during sleep to prevent the soft throat tissues from collapsing and obstructing the airway. They do this by bringing your lower jaw forward and/or by lifting your soft palate. Some devices also stop the tongue from falling back over your windpipe. Address any nasal congestion. Try taking a decongestant or antihistamine if nasal congestion is causing your snoring. Use these only as a temporary measure if you suspect that a cold or allergy is to blame. Prolonged use of either can be harmful. Tape your nose open with nasal strips. These are available at most pharmacies. They may look odd, but who's looking? Following the directions on the package and tape one of the strips to the outside of your nose. They work by lifting and opening your nostrils to increase airflow. Consider using a sinus, nasal rinse. These are designed in such a way that the debris and mucus formed in the nose is completely flushed out. Rinsing will be helpful in relieving yourself of the snoring. Talk to your doctor if you struggle with chronic sinus infections. Get a prescription for nasal decongestants. Reducing the infection will help to cure your snoring. Pick a time to talk. Confronting your partner about their snoring in the middle of the night or immediately upon waking after a restless and sleepless night can cause resentment and arguments. Avoid angry discussions about sleeping, and keep the discussion light. Remember that snoring is a physical problem. Whether you're a snorer or live with one, there's nothing to be embarrassed or angry about. It's not a conscious choice the snorer is making, but it is a physical concern that can be remedied with a little planning. Be aware of deeper issues. Talking about snoring may inadvertently lead you into discussing smoking, drinking, weight, or other sensitive issues that may be affecting your relationship with your partner. Be aware of the territory your conversation might get into, and communicate thoughtfully and tactfully throughout the discussion.